So as a provider, I tell my patients the importance of physical activity and staying active for their physical health. It brings down blood pressure, it can lower cholesterol levels, improve diabetes, make arthritis better, but it also helps with mental health.
Of course, I talk to my clients as a personal trainer, just looking at ways they can fit in exercise to help that reduce their anxiety, increase their mood, and just find time for themselves. Because I think with mental health, depression, anxiety, we get so in our heads. And when we spend some time, working on ourselves, it actually levels everything out.
Yes, having patients with anxiety, we'll also talk to them about the importance of activity, physical activity, exercise, how it releases the endorphins, lowers tension, and just general feeling of well-being improves.
Yeah, and I think sometimes people think exercise takes your energy out, when in reality, exercise gives you energy, and that's exactly what you need when you're going through struggles with mental health, whether it's depression or anxiety.
Well, and we know exercise improves resilience.
Oh.
So having a regular activity when you're going through physical or emotional challenges, that resiliency helps with healthy behaviors rather than getting caught up in unhealthy behaviors such as alcohol or drugs that ultimately is going to make your symptoms worse.
Yeah, and that's exactly how I talk to my clients, because every time you do something that's just a little bit hard for you, you get over that hump and you realize, oh no, I can do this. And it's just that mental capacity of doing one thing more with your body and your mind.
Yeah. And we know that it improves your immune system. So how much exercise is enough?
I say with clients, it depends what you like, but 150 minutes of exercise per week. That's 30 minutes, 5 days a week, or you could go into more vigorous activity and 3 times a week, 20 minutes going hard, and that should meet the requirements of making you feel like you can sustain and be your best.
Yeah, so for someone who's just starting out on an exercise program to improve their mental health, what recommendations do you have?
I recommend first, do something you like to do. Okay, that's something that you're going to do every day. It's gonna be something you look forward to, and that's going to help how you feel. The second thing is tell someone else. Tell someone that you're trying something new that will hold them accountable. Okay, and then likely, whether it's outside, I do think moving outside is one of the best things you can do for your mental health, even if it's cold, in the rain. It's gonna boost your mood.
So Dara, what are some exercises people can do to get started?
Oh, I'm glad you asked. The first thing is we're sitting right here. Posture, right? We're sitting at desks, most of us, whether we're driving in the car, right? Posture is important. So go ahead, put your arms behind your back. If you can, clasp them. Okay, you can feel yourself sitting up taller, right? It's easier to breathe.
It is.
Okay, that's what exercise is. It's getting those muscles strong enough so that we can sit up nice and tall. Okay, we can feel good. A lot of our tendency is moving forward in this way. And so you can follow along with more exercises with our free videos on Short and Sweat on YouTube. And then if you're so inclined and you have families are invited to join us for free fun challenges with Hy-Vee Kids Fit, all online.
Well, thank you, Dara, for talking with us today on physical activity and mental health and how activity and exercise supports them both.
Of course, I am so excited that we have all these solutions for families around mental health and exercise.